The broadcast is now starting. All attendees are in listen-only mode.
Good evening, everyone. This is Dr. Lauren Levine. I wanted to welcome everyone to tonight's webinar. We had a few hundred people that were registered for the webinar, so I think we've hopefully got a really good topic tonight. I'm very impressed with our speaker, so I know it's going to be a good webinar. I'm only going to speak for a couple of minutes. I want to make sure that Ron can speak for as long as he'd like. We also want to make sure that we leave as much time as possible for people to ask any questions. All of you on your screen should see a little box that's your GoToWebinar control panel where you can just go ahead and type in those questions as you think about them. We may not get to most of them until the end. If there's something relevant to a slide that he's on, I might interrupt him, but we will certainly get to the questions in the order that they were asked at the end of the webinar. When you sign out, you're actually going to have a short little questionnaire. There's actually some offers that Ron's going to be making tonight. You're welcome to take advantage of those. You just indicate on those what you might be interested in. You'll also get an email sent to you within the next day or so. Many of you know that I do tend to record these webinars. We are recording this one as well. So don't worry if you can't make it towards the end or get distracted for a little bit. We are recording the audio and the video. You'll be sent that link sometime within the next couple of days. For those of you who don't know me, as I said, my name is Lauren Levine. Many people know me as the digital dentist. I was a practicing periodontist for 10 years. I work with offices all over North America who need help with their technology decisions. Mostly lately it's been offices trying to get HIPAA compliant, get chartless or paperless, but there's a lot of other things that we do. A service that I've been offering for about 4.5 years now are webinars. And at least a couple times a week, usually we're offering webinars on areas that I think are just interesting. It may not necessarily be my current area of expertise, which is technology, but we do implants, we do forceps, nitrous. I mean, there's a lot of topics that we're covering, and certainly we've got a really good topic tonight. What we're going to be talking tonight is about recall, and certainly it's critical for a lot of practices. As I had said, I was a practicing periodontist for 10 years, and of course, like a lot of people who aren't necessarily very bright when they come out of school, I just figured I could start my practice on my own. I didn't really need any help. And the first couple of years I struggled. I wasn't sure why, because I thought I was clinically very sound, and I was nice to my patients, and things were working well. I finally got smart and hired a consultant. This was the Levin Group. This is back in early 90s. And what I was shocked to see when they finally started analyzing my practice is how poor my hygiene department was. That I really was just letting thousands, tens of thousands of dollars walk out the door every day, not being aware of how I should be recalling these patients and getting a proper recall system in place. To me, it was always just an afterthought. And I finally came to realize that the hygiene is actually, in a lot of cases, the lifeblood of most practices. Now, as I said, I have practiced for 10 years, and while I can certainly talk about hygiene and recall, the systems that we have nowadays are significantly more sophisticated. And rather than have me talk about it, because I haven't practiced for a number of years, I brought in someone who I really consider to be an expert in this, and that's Ron Barsotti. Ron is the president of Recall System Pro. Prior to founding that software, he spent 20 years as a practice management consultant and assisting dental teams. He focused on maximizing the growth and productivity of their practices while also making sure that patients had the highest standards of treatment, service, and care that was possible. Recall system management was really the focus of his work with dental clients, and it resulted in the development of something he'll be mentioning tonight, which is Recall System Pro. It's really the dental industry's first fully automated patient recall system software solution. Ron's a leading authority on the importance and impact of patient recall on practice productivity and success. He's a frequent speaker at a lot of dental meetings, and he talks on practice management and productivity enhancement. So without further ado, I'm going to turn the mic and the screen over to Ron. And Ron, we're looking forward to tonight's presentation.
Thank you very much, Lauren. I'm delighted to be with you in the webinar this evening and discussing how patient recall and recall system management can contribute to the growth and success of the practices participating this evening. I just wanted to start off by just thanking you for hosting this webinar. We have many clients that participate in your programs and acquire a great deal of value out of the programs that you provide.
Well, thank you very much. I appreciate that.
Yeah, no, you're very, very welcome. Before I get started, Lauren has shared a little bit about my background, and I have been, prior to founding Recall System Pro, I spent 20 years providing management services to dental practices located actually in Calgary, Alberta, Canada, where it's a little cool today. And as part of that, we worked with a pretty wide range of practices, solo practices, large group practices, and the overall focus of our work was really to help practices implement systems that help them to be more productive and also to deliver high standards of treatment, service, and care to their patients. And over the years, we spent a lot of time focused on patient recall and recall system management, which Lauren has shared, eventually led to the development of patient recall software solution that's really played an important role in the growth and success of the dental practices that we have worked with. And one of the things that, as far as the goals that we had for your presentation this evening, I'd like to share with you some of the most important lessons that we've learned over the years related to patient recall, the role that patient recall can play in helping dental practices to be more productive and more successful. From there, I'd like to provide you with some insight into the difficulties and challenges that we see dental practices struggling with when it comes to patient recall, and some of the steps that practices can take to deal with these problem areas, recover revenues, and really prevent the loss of patients. I'll then finish off the session with some information regarding the types of recall solutions that are available in the marketplace, and I'd also like to provide you with an introduction to Recall System Pro, a software solution that we've developed to assist dental practices in the area of recall. So I'm very excited about participating this evening. I'm hoping to be able to answer all of your questions once we've completed the presentation. And I think what I'll do is I'll just start off with sharing with you certainly our experiences related to the importance of recall. I think that in all the work that we've done with dental practices, what we found is that patient recall is one of the most important systems to overall practice productivity and success. In addition to the beneficial impact that patient recall has on the dental health of patients, recall systems also drive hygiene revenues and dentist revenues. And they also have a significant impact on patient retention and practice growth, which are certainly critical to long-term practice success. When we first started in dentistry, we certainly understood that recall was important, but it did take us a while to accumulate statistics that helped us determine the actual impact that recall had. And I'd like to share just a few of those statistics with everyone participating this evening. We've been monitoring clients over many years, and one of the first statistics that was eye-opening for us had to do with the percentage of overall practice revenues that are generated from hygiene departments and dentist revenues generated from recall exams and recall patients versus new patients. We do seminars and workshops where we ask participants what percentage of revenues do they think are generated by hygiene departments combined with dentist revenues that are generated by recall exams. And most participants are surprised to find out that over 75% of overall practice revenues are generated from hygiene and recall exams, both of which are driven by how well your recall system is working. And for practices that do not generate a lot of new patients, it can be significantly more than that, up to 80 to 85% of revenues. This was certainly an eye-opening statistic for us, and many of the practices that were exposed to this information. All of these results flow from one system, which we think really gets to the heart of how important recall is to the financial viability of dental practices. And it all points to the fact that when 75% of practice revenues are available from patients in a practice, versus needing to generate revenues from marketing and attempting to attract new patients. So what we find is there's certainly a lot of focus and attention on external marketing and attracting new patients, which is certainly an important aspect of practice building and growth. But what we also see is that not enough attention is given to patient recall and the revenue opportunities that are available to practices by focusing on recall system enhancement. And what we have found is that it's not uncommon for dental practices to be financially struggling or not doing as well as they could while sitting on tops of all kinds of revenue opportunities without even realizing that it's there. How we've come to understand the revenue opportunities available to practices is over the years we developed a diagnostic tool that really helped us to understand the scope of untapped revenues sitting in dental practices. And I've brought a sample of this report along to show you the kinds of results that we are seeing. And we've run this report on hundreds of practices, and the results that we have seen are pretty consistent across the board. Here is a sample of the report. I'll just show you how it works and what we typically see. And this is the actual practice information that we have permission to use where we've protected the identity of the practice. And essentially what this report does, the first thing the report does is it identifies the number of active patients in a practice based upon actual appointment information. The report then analyzes how often patients are returning for their hygiene and recall appointments on an annual basis based on 3, 6, 9, 12, and 15-month frequencies and intervals. And as far as problem areas that we see practices struggling with, the vast majority have got to do with the percentage of patients that are coming in for their hygiene recall visits at 12-plus month intervals. So in this case here, what we're seeing is that a full 40% of patients are returning for their hygiene and recall visits at 12-plus month intervals, and of those, 25% are at 15 months or more. So besides the dental health implications and also the lost hygiene and restorative revenues that are not realized by having patients return more often, the reason that this is a problem is that patients that return at 12-plus month intervals, certainly from our experience, are more difficult to schedule and keep scheduled than patients that return more often. They're more likely to cancel and not reappoint, and they're at higher risk not to return at all. So when you consider that 40% of this practice's patients fall into this category, it can turn into a very significant problem. And the end results is that we tend to see that anywhere from 25 to 40% of practices' patients are returning in the 12 to 15-month intervals. And as a result, practices are losing out on 12 to 15% of revenues they could otherwise be generating by having their patients come in more often. The annual attrition in these practices is 10 to 12% of patients or even higher. So they experience low growth, no growth, or their practices are actually shrinking. And the proof of that, Dr. Levine, as you spoke a moment ago, is if you analyze the charts of a practice, what you find is that most practices are sitting on top of thousands of lost and overdue patients. So what I'd like to do next is just share with you and talk to you about why this occurs and what it is that practices can actually do about these kinds of challenges, which is, ultimately why we're here this evening. We've spent a lot of time working in dental offices and analyzing why these problems occur. And from a big picture perspective, what we found is that recall is certainly one of the most difficult and challenging of systems for practices to really get a handle on. And we found that practices tend to struggle with a number of common problems that are very costly and time-consuming. And we've identified 3 areas that dental teams tend to struggle with when it comes to patient recall. And I'd like to just cover these areas off with you and then just share with you how we've gone about dealing with these problem areas. The very first, as if you excuse me just for a second here, minor technical problem. The very first has got to do with practice management software systems. In our work with clients over the years, we have worked with the continuing care and recall system functionalities of the leading practice management software systems. And not to be critical, what we have found is that practice management systems are simply not easy for busy office staff to work with, particularly related to dealing with patients that have fallen out of schedules and gotten behind in their recall. It's very easy for significant numbers of unscheduled patients to get lost in these systems. And when they do get lost, they are not easy to find. These systems allow you to run lists to locate patients that have fallen out of your schedules. But you're not sure if you're capturing all of your patients if they haven't been tagged properly as far as their continuing care is concerned. And certainly our experience is, a good 25% of patients in practice management software systems are typically not tagged with any type of a continuing care. And that's a large number of patients not to be picked up as far as your recall is concerned. The other problem that we find is that staff can spend hours trying to put together and manage lists that are time-consuming and cumbersome to work with, and do not provide staff with any kind of a centralized way to be able to work on recall as a team. And the end result is that staff can spend a significant amount of time running lists and managing information versus contacting and scheduling patients. And when you consider the amount of movement that goes on in the schedule on a day-to-day basis, by the time you run a list, it's pretty well outdated by the end of the day. And certainly from our perspective, if you're wanting to acquire some traction on recall, it really does take a team effort. And it's impossible to do that with paper lists or without instant exchange of information between staff. And really what you don't want to have happen is, patients being contacted by two staff members, so it looks like the right hand doesn't know what the left hand is doing, which can be a common problem when it comes to recall system management. So from a recall system management perspective, practice management systems are simply not as efficient as they need to be when it comes to recall, and they haven't really been designed to take that job on. The other thing that we have found is that automated patient appointment reminders, although important, we're simply not comprehensive enough to deal with recall. We're certainly believers in the value of automated appointment reminders. We've worked with them for many years before we developed our software solution, and we have them built into our solution. But what we found is that they're certainly important time savers, and you want to make best use of them where you can. But alone, they're not very effective in reaching and getting patients that have fallen out of schedules appointed. The reason for that is, the average practice has emails and texts and permission to use them for about 60% of their patients. And of these patients, less than 20% of them respond to reminders to schedule their appointments. So you end up with about 12% of patients that are reached and respond to these systems. And if you rely on automated appointment reminders alone to schedule your patients, it can turn into a major source of lost revenues and lost patients. So for practices that really want to boost revenues and bring up their patient retention, they need to find other ways to reach and schedule these patients. And one of the things that I thought you might find is interesting, Dr. Levine, is that from a technology standpoint, a big problem associated to these types of results is not technical, it's actually behavioral. And what we found is that essentially patients will just make more of an effort to keep an appointment they have than schedule an appointment they do not have. And from a technology perspective, we would like to think that automated reminders should be able to handle all of this, and it certainly helps, but it's simply not a complete solution. And in this case, human behavior, particularly when it comes to recall, certainly trumps technology. The other final challenge that we see in dental practices when it comes to recall is that virtually every office that we've worked in, office staff are certainly swamped trying to keep up with everything that needs to get done on a day-to-day basis. And they certainly have their hands full serving patients, filling openings, and keeping up with everything that needs to get done on a day-to-day basis. And when you add to that, recall being a demanding system in and of itself, and staff not having the tools they need to get to recall and actually stay on top of their recall, the end result is all kinds of slippage, lost revenues, and lost patients for practices. And one of the biggest problems that we found with recall is that it's notoriously subject to slippage. Because patients are booked in advance, by the time that you find out that you actually have a problem, it's actually too late to do anything about it. And many times it takes weeks, if not months, to actually correct. And in the meantime, practices are dealing with empty chairs, lower productivity, and all kinds of stress. And one of the hidden costs that we found associated with these problems is, besides the less than optimal dental health for patients, open or broken appointments cause stress for dental teams. And, when they become chronic, it's very easy for, finger pointing to start in dental practices. And I think the common misconception that we see among dental teams when scheduling problems start to occur, is that, someone is not committed or doing their job properly. And really, when you take a look at what is going on underneath the surface, what you find in the vast majority of cases is that scheduling problems do not occur because someone's not committed or doing their job properly. Scheduling problems occur as a result of staff not having the systemization and the right tools to actually get the job done. We certainly all understand the importance of having the right instruments and tools to get clinical procedures completed. And, the same principle applies here. When it comes to recall, we see in the vast majority of cases committed office staff really struggling to keep up because they don't have the resources, time, or tools to properly get the job done, and really not because they're not competent. And finally, the common question that we hear from many dentists is that, I have new patients coming into my practice and I just do not understand why my practice is not growing. And I think the answer to that question has got to do with the fact that patient attrition that is really going on underneath the surface, which is, for the most part, not measured, not managed, and for most practice, not even being noticed. As I shared earlier, the average practice loses about 10 to 12% of their patients on an annual basis. And you extrapolate that over 5 years, and that easily equals to half of a practice's patient base being lost. It really gets to the heart of why practices get to a certain point and then actually stop growing regardless of their new patient flow. And so for what we've seen is that for practices really to get beyond this, they really need to start focusing on retaining their existing patients as much as they do attracting new patients. And this is where growth opportunities really start to occur. And so there's a real opportunity to focus on recall and patient retention. And the other thing is, given that it costs 10 times more to attract a new patient than retain an existing patient, it's also very, economical to do so as well. So we have had to deal with these challenges in our work with dental practices over many, many years. And we felt that there could be a lot more done to assist dental practices in these areas. So what we did is really two things. The first thing that we did is we identified 3 steps in our consulting practice that every dental practice can take to minimize the impact of these problems and really get the most from their recall systems, whether they're using an automated solution or not. And the other thing that we did is that we developed a complete and comprehensive patient recall solution that really helps dental practices to increase their revenues and also their retention of their patients. So what I'm going to do at this point in the webinar is just basically review the steps that we've developed so that practices that are interested in taking advantage of them can certainly put them to work. And again, whether you're using software solutions or not, these 3 steps are, very effective to getting Recall working on your behalf. And then from there, I'll show you how we have automated all of this into a software solution for practices that are interested in taking things to another level. So let me share with you the very first step. In the very, first step involves pre-appointing patients before they leave your clinic. From our viewpoint, this is the single most important thing you can do as far as retaining patients and making recall manageable for your practice. And the goal here is that you really want to pre-appoint 90% of your patients before they leave. And the principles behind this are pretty straightforward. It's much easier to move a patient that has an appointment than it is to try to schedule a patient that does not have an appointment. And as I shared with you earlier, we have certainly clearly found that patients will make more of an effort to keep an appointment they have than to schedule an appointment that they don't have. The other thing is that pre-appointing also prevents patients from getting lost in your practice management system if they're not in your schedule. And the other thing that occurs if you do this, as your hygiene schedule fills, your patients will also start to give your schedule more consideration and respect when they're not able to acquire appointments at the drop of a hat. As far as how to go about successfully implementing this step, what we find is that office staff tend to be concerned of, patients are going to resist scheduling. They're not going to be willing to schedule appointments 3 to 6 months out. And, the most effective way of handling this is really to take the pressure off yourself and your patients. And it's important to keep in mind that when you ask a patient to schedule an appointment 6 months out, you're not asking patients for a hard commitment. You're asking patients for a tentative commitment that ensures them, a spot in your hygiene schedule that they can always change if they need to. And if patients really understand that, they're more likely to book an appointment. They're more likely to less resist scheduling an appointment with your practice. And as part of that, one of the things that we advocate is that using the right language and communicating with confidence can be of great benefit to patients and assisting patients with scheduling their appointments. When you're using communication guidelines or scripts that are well defined, and you can assist patients to understand that really where you're coming from is that you're wanting to ensure that they don't get behind in their hygiene, and that they're able to acquire services in a place in your hygiene schedule when they need it. They're much more likely to cooperate, and having the appropriate languaging for that when you're speaking to patients really helps. The other step that I think is very important, and we've had many practices implement and have been quite successful with, is related to confirming patients sooner. Given that patients are booked out 3 to 6 months in advance, in order to minimize day of openings and cancellations, you really want to ensure that at least 90% of your patients are confirmed before their appointment dates. And in order to do that, most practices need to start confirming their patients sooner than what they already are. And the principles behind this are pretty straightforward. If you start confirming sooner, what you will find is it gives your patients more time to keep or move their appointments. It certainly gives you more time to confirm and fill appointments, and it significantly reduces cancellations and no-shows. And in order to achieve these goals, what we recommend is that most practices need to start confirming appointments at least 2 weeks in advance. If you wait, a few days or a week before you start to confirm appointments, you're likely going to experience higher levels of cancellations and no-shows. And what we find is that, most practices do not want to start sooner because they do not have the time, and at the same time they don't want to deal with patients that would potentially want to move or cancel their appointments. And when it comes to not having or making the time, certainly from our experience, it really comes down to a question of really choosing your pain. You can either deal with the pain of contacting patients sooner and getting appointments confirmed, or you can deal with the pain of having to continually fill same-day openings and cancellations. It's certainly, from our perspective, all pain from one perspective, but the difference is that one is temporary pain and the other one is chronic pain. So the pain of confirming appointments sooner until you get a system set up is temporary pain. Once you get a system set up, it gets easier and that pain goes away. However, the other is basically chronic pain. Nothing's going to change, related to having to deal with the stress of having to fill same-day openings and cancellations, really until you get your patients confirmed sooner. And again, related to this, we can't stress the importance of using the right language, which really helps. Using a simple word like reserved when you confirm your appointments goes a far way, and certainly building value and reducing cancellations. The use of that kind of language when you're scheduling and confirming appointments can go a very far way. The final step that we tend to focus on is focusing on your contacting and getting your due patients scheduled. Most practices have significant numbers of patients that are late and overdue in their files, which can be a pretty daunting task for staff to try to deal with. And really the trick here is, rather than trying to follow up on all your patients all at once, you really want to focus and concentrate on contacting patients that are due or coming due for their appointments, and getting at least 90% of these patients contacted before their due dates. And basically the principles behind this is that patients are coming due for their appointments are typically a list of patients that are going to be the most responsive. It certainly sends out the right message as far as the practice caring enough to contact them before they're due. Patients would be well advised to keep their appointments. And the other principle behind this is that if you're not able to keep up with everything that gets done, what you need to do is to do the things that are going to provide you with the most leverage. And most staff can find or make the time to tackle this list with everything that's going on in the practice in 1 or 2 hours a week. And the other thing that we wanted to share is that you don't have to directly contact and schedule each patient either. Even leaving a personal message is of great value. And again, this is where using the right language and leaving the right messages is important here. So what we've seen is that we've worked at these steps for a very long time, and for practices that have incorporated them, it's really made a very significant difference in their ability to deal with many of the problems, keep their patients scheduled, and be able to maximize the benefits of their recall. And so what we're actually very pleased to do here, for practices that want to take things to another level and lever their revenues and patient retention and provide staff with tools that enable them to get a handle on their recall, we've developed a patient recall software solution that I'd like to spend just a few minutes introducing everyone to and giving them a sense of how we've developed the software. But in the meantime, we'd also like to share that for those of you that are interested, we are happy to send you our call coaching scripts that we've developed over many years to help dental practices confirm appointments and schedule patients, and also deal with various types of scheduling problems that do occur. So as we're completing the webinar tonight, as you're leaving, a screen will come up, and if you're interested in those call coaching scripts, you can just let us know, and we'll make sure that we get a copy of them to you. As far as our software solution is concerned, in addition to providing dental practices with the benefits of patient reminders, we also did 3 things to assist practices to deal with the problem areas that I've covered off here today and recover revenues and boost their patient retention. The first thing that we did is we automated and streamlined all of the continuing care and recall system functions that practice management software platforms provide to really automate workflows and help save time and prevent patients from getting lost. The other thing that we did is that we provided staff with some very practical and functional tools that make it possible for them to reach patients and schedule patients that aren't reached or do not respond to automated appointment reminders and keep up with their recall. And finally, we built in a reporting system that we've worked with for many, many years that really monitors results and a number of key indicators that help identify potential problem areas with recall before they have a chance to escalate and cause slippage for dental practices. So what I'd like to do is I'm just going to close this file here, and I'll show you. There we go. How our software application works. Essentially, this is an overview of the applications and some of the functionalities that we've developed. The very first thing I'd like to do, if you could just give me a second here. There we go. So the very first thing I'd like to do is just share with you that the software is a cloud-based application that works alongside of major practice management software systems as an add-on. So it auto-extracts all the information that it needs without any need for information to be inputted into the software by office staff. It's just fully automated and extracts the data from your practice management software application. The very first thing that we did to assist staff to save time and streamline their days is we built a toolbar that works alongside your office's practice management scheduler. And what you see here is we just got a sample copy of a practice management scheduler up on the screen here. And on the right-hand side here, what you'll see is just Recall System Pro, the toolbar that we've developed so that staff have instant access to the software and everything that they need to manage their recall and get patients scheduled. So with this particular toolbar, staff do not need to leave their schedules or interrupt their daily workflow to use the software. It makes it very easy to use and integrate into the day-to-day. The software, the toolbar sits on the right. It can be moved to the left. It auto-hides, it auto and you can bump it just to bring it forward when you need it. And it's very quick and fast and certainly saves staff all kinds of time when it comes to working with the software on a day-to-day basis. The first thing I'd like to do is introduce you to the patient list that we've built into Recall System Pro. And as we shared earlier, this is one area dental teams really struggle with. It's hard to make a list, keep the list updated, and prevent patients from getting lost. And what we've done is we've taken this just to a whole other level to assist teams. And what you see here are essentially 2 types of lists. First, these lists are lists of patients that have hygiene and recall appointments scheduled that have not confirmed their appointments. So in addition to tracking patients that fall out of schedules, Recall System Pro also provides practices with lists of patients that have not confirmed their appointments and make it easier for staff to contact these patients, get them confirmed, and minimize day of openings and cancellations. And the second list are lists of patients that do not have appointments and that are actually coming due and or falling behind in their hygiene appointments. And Recall System Pro keeps these patients organized by whether, again, they're coming due or if they're overdue and how overdue that they are. And with Recall System Pro, it's virtually impossible for patients really to get lost in the system. Your patients are really in one of two places. They're either in your scheduler or in a list. And if you remember the patients that come in at 12-plus month frequencies that we discussed earlier in the presentation, when any of those patients fall out of your schedule, essentially within 20 minutes, they are captured and they show up right here on the appropriate list. So as I'll show you in a second, Recall System Pro gives your staff all kinds of tools to certainly keep these patients scheduled and prevent them from leaving your practice. And as far as making the benefits of automated messaging available to dental practices, each one of these lists have an automated email and text message or appointment reminder that goes out to patients in the background, either confirming appointments or reminding patients to actually schedule appointments. And patients receive emails and text messages that provide them with a button that they can click to confirm or request appointments. When patients actually do that, that information is sent right here to the desktop and enables staff to quickly confirm or get patients scheduled very, very, very quickly. And as I shared with you earlier, it's certainly a very valuable feature that can help staff save all kinds of times. But if you really want to make, and you really do want to make best use of it where you can, but for the 90% of certainly unscheduled patients that aren't reached or don't respond to messaging systems, I'd just like to show you how Recall System Pro can help offices get those patients scheduled. First of all, these unscheduled patients here, the lists help staff in a number of ways. Not only do they ensure that patients don't get lost, staff are really not having to spend any time compiling lists or trying to organize and manage information. Everything is really automated and organized and updated for them right here. And this is a huge time saver for busy office staff. Staff can spend more time contacting and scheduling patients rather than trying to manage information. And the other thing is, because of the way that these lists are prioritized, staff can make best use of their time when they're ready to work. And as we discussed earlier, staff can focus on specific areas of their recall. For example, in this case, focusing on their due patients if they know that they're going to get a good result from that, and catch up on the other areas when they actually have time. I'll just show you how these lists work and some of the tools that we've built into them to help staff get patients scheduled. This is a list of patients that are 1 to 6 months overdue or late for their regular hygiene or recall appointment. And when you open this list, what you see is essentially the name of the patient, who their dentist is, and the actual date they were due for their last hygiene or recall appointment. And then the next thing that you will see are these symbols here, which are these little envelopes. And these envelopes identify patients that have email and text messaging and have been sent an automated message. And with these symbols here, staff are able to quickly identify which patients they need to be contacted to get scheduled and which patients it makes sense just to wait and see how they respond to the messaging system. And this in of itself is really a huge time saver. It allows staff to cover way more ground and reduce a lot of time, wasted time, actually chasing patients. Other time-saving features and tools that we've built into the software, I'd like to share with you the patient information file. And what we have done here is essentially provided staff with all the information they need to actually get the job done properly in the first place. What you'll see here is the name and the contact information, the medical alert information, and the continuing care information and appointment history. In practice management systems, essentially you have to click 3 or 4 screens to acquire this information. And when you need it in the moment when talking to a patient, essentially it's not there. And we've also given staff family appointment information. So when they're talking to anyone in a family about hygiene or recall, they can actually get everybody updated at the same time. When staff are actually ready to make calls, the software provides staff, and as we were talking earlier about the importance of using the right languaging, automated call scripts, which each one of those lists has a script and gives staff effective language to confirm and schedule patients. It really helps build confidence, and we have all kinds of scripts built into the software to help staff deal with difficult situations. It's a great training tool and ensures consistent communication with patients. When staff are actually done making calls, they can just quickly update the patient file here and indicate, if they've scheduled an appointment or if they've made some sort of a contact with a patient and what the details of that would look like, and they can quickly submit that. The benefit of this is that everyone on the system, this updates in real time, and everyone in the system knows what is going on and certainly stays in sync. But also, it also updates not only the patient file information, but it also updates the patient list information with this little symbol here. And the benefit of that is that it really makes working on recall as a team possible, which is hugely valuable in terms of distributing workflows and responsibilities, particularly in larger practices where staff can actually share the work. This can be loaded on every computer in an office. You can have people working on recall in different parts of the office, etc. And the lists, what we find is many dental practices, what they'll do is they'll actually share the responsibility for different lists among staff members. And so there's no paper shuffling, etc., and it just makes distributing recall and tackling recall as a team just much more easier to do. The other feature that I'd like to share with you that we get a lot of positive feedback has got to do with a short notice feature that we've developed to help staff fill open and broken appointments. With this particular feature here, staff can quickly assign patients to a short notice list, and Recall System Pro allows them to actually do a couple of other things. First of all, they can assign patients to a short notice list based on a certain type of an appointment. And the other thing they can do is they can assign patients at specific times that a patient might be available for an appointment. So a specific day of the week, or a specific time of the day, or a specific day entirely. So they can submit that information very, very quickly. And when it comes time to actually fill the appointment, staff can quickly access their short notice lists, which are located right here, which you'll see is 3 different types of lists. From there, this will provide a complete list of patients that, in this case, are available on hygiene. From there, staff can actually search and locate patients that are available at a specific time. In this case, we're trying to fill an appointment, let's say Wednesday at 9 o'clock. And what this software will do, it will bring up the patients that are actually available for appointments at that particular time. Staff can then quickly send those patients out an email, which advises the patient that there is an appointment available, and they actually need to phone in, and first come, first serve as far as those appointments are concerned. And from there, they just click and actually wait for the phone to ring, which doesn't take very long, given that you're focusing on patients that are available at specific times. This has been really well received. It takes a huge amount of stress off of office staff, and it saves an enormous amount of time, and it really adds to practice productivity. I mean, the average practice cancellation rate is anywhere from 10 to 12 to 15%, and at the very least, this feature here helps dental practices to cut that in half, and that can certainly add up to a significant amount of revenue on an annual basis. And that is that is as far as the tour of our product is concerned. So in addition to these features that we built into Recall System Pro, we have a complete monitoring and management reporting system that I have shared with you that we built into this software. And as far as wrapping up the session, Dr. Levine, before we get into the question and answer, I wanted to talk a little bit about the financial opportunities that are available to dental practices utilizing our software and actually focusing on recall system enhancement. We have tracked the results for many years in a wide range of practices, and we also use that diagnostic tool that I introduced you to at the beginning of the webinar to identify increases in hygiene and restorative revenues that are available to dental practices, focusing on recall enhancement. And I don't want to go into too much detail related to this, but I'd like to show you how it works. And anyone that'd like to find out more about this, we're certainly happy to provide them with that information. But essentially, this is how our revenue analysis tool works. If you remember the chart that I showed you at the beginning of the session, we're able to analyze how often patients come in returning for their hygiene or recall appointments on an annual basis as far as 3, 6, 9, 12, or 15-month intervals are concerned. And with that information, we're able to determine what the corresponding number of annual appointments are. From there, we can compare and benchmark these frequencies to practices with well-functioning recall systems and determine what kind of increase in appointments and what kind of increase in annual revenues are available from utilizing our software and focusing on recall system enhancement. We have years of data available as far as benchmarking is concerned, and these are really the type of results that are available for practices that are focusing on recall with the right tools. In addition to identifying hygiene revenues, we're also able to identify increases in restorative revenues that are available. And the way that we do that is we know by analyzing hundreds of thousands of appointments that about 60% of increases in hygiene appointments actually result in recall exams and increases in diagnostic opportunities for dentists. So knowing this number, we can quickly determine the restorative revenue opportunities available to dental practices by just multiplying the increases in recall exams by an average restorative production per recall exam. And certainly every practice has an average that is relatively easy to identify, and as we discussed earlier, it's usually based upon the percentage of dentist revenues that stem from their recall and recall exams. So what we have, we've certainly run this report on hundreds of practices in addition to our experience in working with dental practices, and what we see is that a 10 to 15% increase in revenues is achievable for practices focusing on recall system enhancement and using our software within the first 12 months of getting started. Certainly some practices just take right off and right out of the chute and experience some pretty substantial results that they're able to achieve. And finally, the other factor that is important to keep in mind as far as evaluating the benefits of patient recall are the effects of patient recall over time. So, not only does hygiene and dentist revenue increase, but so does patient retention. And over time, this really starts to have a reinforcing and a flywheel effect. And for practices that have implemented sustained recall systems over time, we've seen that 20 to 25% revenue growth is certainly readily achievable. So just before we move into the question and answer, I wanted to thank you for hosting the event. We hope we've been able to provide some information that would be of value to the practices participating this evening. For those of you that might have an interest in Recall System Pro, the software costs $395 per month on a subscription basis, and there is no contract. Along with that, we certainly provide a free trial of the software. And also for practices that are wanting to determine the revenue potential that is available to them in their practices, we're certainly happy to provide a free revenue analysis on a no-obligation basis so that practices can see for themselves the type of revenue opportunities that are available to them. And certainly as a special offer to dental technology consultant participants this evening, for practices that actually register a demo for the software within the next 60 days or 7 days, we're certainly happy to deduct $600 from the annual subscription fee, and we're certainly happy to do that as part of our participation in the webinar this evening. You can certainly contact us at the information located on the screen there, and as Dr. Levine has shared, I think there's also an opportunity to acquire that information from us once you complete with the seminar.
Great. Well, thank you, Ron. This was a great presentation, and don't go anywhere too quickly because we have a number of questions. I hope you're going to stick around for a little bit.
Yeah, no, I'm good. I'm good with that. Thank you very much.
Good. I would certainly remind people that if you do have some questions for Ron, this is a great time to start thinking about asking them. We do have a number of questions that have already coming in, but just go ahead and type them as you think about them. So let's get right to the questions here. How automated is the system? Sometimes people have very busy staff, and it's hard for them to really use it. Is it handling most of the work for them?
Yes, it does. It really serves to automate and streamline their day-to-day workflows. And again, the other thing that occurs is that all of this information is auto-extracted from their practice management software platforms. So staff are not required or do not have to provide any input into the software whatsoever.
That's always good.
Yeah.
In one of the slides, you were talking about patient reminder systems, and obviously people on the call have probably heard about some of the other systems out there, DemandForce and Smile Reminder and Lighthouse 360 and Yappy, ones like that. How is Recall System Pro different than those types of systems?
Well, I think that those systems are, very good systems. They're certainly more along the lines of patient communication and marketing types of applications. As far as recall is concerned, Smile Reminder, DemandForce, and similar types of systems use appointment confirmations for recall, whereas Recall System Pro is a fully automated patient recall management system. And really the difference between the two, is that, if you're interested in really preventing the loss of patients and taking revenues to another level, you actually need the automation and tools that we built into Recall System Pro in order to do that.
Okay. What about the learning curve? What's the implementation like? How long does it normally get an office trained on it and get them up to speed?
It doesn't take very long at all. We've done this with hundreds of practices, and a couple of things related to the software. If you were looking at the software, it actually mirrors how staff typically work on a day-to-day basis. And so users of the software find it very intuitive to be able to put to work very quickly in their dental practices. Again, it helps them save all kinds of time in areas that they typically lose all kinds of times, trying to handle on a day-to-day basis. And we provide actual webinar training to help staff incorporate the software. And we also provide all kinds of video and instructional support to help practices incorporate the software.
Good. What about practices that are multi-location practices or more of an enterprise type of situation? Can you work with those practices, or is this really just designed for solo practices?
No, the software is actually ideally designed for larger group practices or multi-location practices. In the way that the software is designed, as I showed you with the list, etc., you can be in different areas of a large group practice, having several staff members working on recall at one time. Everybody's in sync with the information and minimizing the amount of crossover that occurs. And the same thing occurs in a multi-location practice. So this is ideally designed from an enterprise perspective. You could have a centrally located recall system set up where you have designated staff members working on recall for a multitude of practices, or you can distribute those responsibilities within those practices. And the software makes it very easy for practices to manage that and actually track through the reporting system what's actually occurring in each practice, with each provider, and actually each user that's using the software as well.
Okay. Let me see, there's a few more questions here. How do you actually see the results of your software? How do you know if it's doing what it's supposed to be doing?
Well, in our reporting suite that I didn't go into tonight, but we have a complete reporting suite that actually shows dental practices, how they're improving in their recall and how the software is actually helping them from the appointments, the increase in appointments, the increase in productivity, etc. And then the other thing that the software does, as I had shared with you, it monitors some of these key indicators. For example, the number of patients that are being confirmed, the number of patients that are being pre-appointed, so that that's able to be tracked on a day-to-day basis, so that you can see, exactly what's happening in your recall system at any given time, and it really prevents the problem with slippage occurring by being able to track and monitor those kinds of results.
Okay. And how long does that normally take? Are you seeing the results right away, or typically is there a time frame before people start to see the results?
The practices tend to see results immediately when they start using the software, and particularly practices that have been struggling with recall and being able to stay on top of their recall. Within what tends to happen is that as you start confirming appointments and patients are organized and being able to staff are able to quickly contact those patients and get them scheduled, the results start showing up pretty quickly.
Okay. And you had showed a few slides earlier where you were showing, typical. I guess that's what my question was. Are those typical numbers? You showed numbers of new patients reactivated and increased production. Is that typical results that you're seeing for your clients?
That is, Lauren. What we see with the clients that not only the clients that have been on the system, but clients that we take in on the system, is that 10 to 15% increases in revenues are readily achievable for these practices. And essentially what we're doing is we're just helping dental practices to get a handle on the patients that simply tend to slip through the cracks, end up finding their way out of these practices. Recall System Pro helps to capture those patients, make sure that they're being communicated with, that staff can have the tools to stay on top of things and get those patients scheduled. And when you really think about it, even the short notice cancellation feature, if you're able to reduce openings and cancellations by 50% for a dental practice, when you take a look at practices experiencing 12 to 15% opening cancellation and no-show ratios, that starts to happen pretty quickly, just on a day-to-day basis, and it contributes a significant amount of revenue to the bottom line.
Yeah, no, that certainly makes sense.
Yeah.
On the demo, you had shown it working with Dentrix. So what other practice management software systems does it work with?
It works with Dentrix. It works with Eaglesoft. It works with AbleDent. And we're currently integrating with SoftDent and a number of other platforms. So if practices are actually interested in the software, the other thing that they can do is they can certainly give us a call and let us know, because we're always incorporating new platforms into our system. And so if there is an interest and you let us know, that helps us to make some decisions about what direction we actually go in.
Yeah, what about some of the web-based programs like Curve or Denticon? Any plans to hopefully integrate with them at some point?
We're certainly open to that. In terms of our pathway, we've got a number of platforms that we're working on right now, and certainly if there's a request and a demand for those platforms, that's exactly where we're going to look.
Okay. So, getting back to that the question we had earlier about the patient reminder systems like Demandforce. If someone's already using one of those systems, do they have to get rid of it? Is there going to be a lot of crossover, or are you suggesting that they just keep your system and the Demandforce running as well?
Yeah, well, that's a great question, Lauren, because we have many clients that actually use both systems. And I think what they find is basically this: Demandforce, Smile Reminder, and the Lighthouse systems are very effective when it comes to patient communications, external marketing, et cetera, bringing patients into a practice. But what they also find is that to have the integrated appointment reminders integrated into a comprehensive recall management system really helps them to stay on top of things and minimize the loss of patients and increase the revenues for a dental practice. And so what these practices tend to do is utilize Recall System Pro for that one component and actually continue to use those other platforms or those other applications for their marketing. And essentially what they do is they get the best of both worlds, contributing to their bottom line.
Yeah, that certainly would make sense.
Yeah.
Well, we are out of questions here. So I want to thank you, Ron. This was a great presentation and some really good information. And I know your time is valuable, so we want to thank you for joining us this evening.
Okay. Well, thank you very much. I really appreciate it.
I also wanted to remind people, as Ron had mentioned, when you're logging out, you're actually going to have a little screen that comes out that gives you 3 choices. Ron has graciously agreed to provide the call coaching scripts that he had talked about to anyone that indicates that they would like that. If you're interested in maybe getting the demo of Recall System Pro, just indicate that as well. And he'd also mentioned that he would be glad to do a revenue analysis for any practices that are interested. So certainly I would encourage people to take advantage of that. Many of you know that we do these webinars on a regular basis, and we've got one coming up tomorrow night. Dr. Peter Evans is going to be talking about biocompatible dentistry and going green, and it's a pretty hot topic as well. I think that's going to be an interesting webinar. We're off next week for Thanksgiving. We are going to take a break for once, and then certainly right after Thanksgiving we get back right into it with a number of webinars that are coming up first week in December. So I want to thank Ron again for joining us. We know how valuable your time is. I want to thank Ron for offering such a generous special to anyone that was on tonight's webinar. I think that's very generous, and I would certainly encourage you that if you're thinking about a system like this, and it seems like it's almost a no-brainer. I mean, when you look at the numbers of increased revenues versus what it costs, it's the ROI is multiple times what it would ever cost you. Certainly worth looking at. So thank you again, everyone, for joining us this evening, and we look forward to seeing you on future webinars. Good night, everyone.
Thank you, Lauren.